The next organism we're going to talk about is Listeria. Listeria is one of those organisms that's going to be on your list of differentials or your distractors, as it were, for the boards, as causing neonatal meningitis. Okay? And we'll talk about that in just a minute. The features of this organism are they're gram-positive organisms. They're gram-positive rods. They don't form spores. They're facultative intracellular. So again, what are you going to see with that? You're going to see a granulomatous response. And they have a tumbling motility, and that may be mentioned somewhere in the question. The species we're going to talk about today is Listeria monocytogenes. Again, these have kind of a tumbling motility in broth. The other thing that Listeria can do is they can cause a polymerization of actin. And when they do that, they cause actin to polymerize in the cell, and they can ride that actin polymer as almost like a surfboard or something right into the next cell. So they never have to go outside of a cell and then into a cell. They can propel laterally from cell to cell to cell. They're facultative intracellular, so they can escape our normal mechanisms of killing, and they can also grow in the cold. All right, so when you put your cold cuts and everything else in the refrigerator, Listeria grows just about as well in the refrigerator as it would in an incubator or as it would in you. So all the other organisms are being inhibited in the cold, and Listeria is just flourishing in the cold. And that's one of the ways you can actually help select for Listeria. The reservoir, you'll find it a lot in animals, domestic animals. You find it usually in livestock and cattle. So it's transmitted generally from unpasteurized milk and dairy-type products. You see it in soft cheeses and deli meats, and almost on an annual basis you'll hear somewhere, if you pay attention, a recall on hot dogs due to contamination with Listeria. So its transmission is foodborne. It's also vertical, so a mother can transmit it to her infant as she's delivering it, or this one can also cross the placenta. Okay? And we'll talk about those different transmissions in just a moment. Pathogenesis includes Listeria lysine O, which is beta-hemolysin. As well, though, remember it's facultative intracellular, and that's going to play a big role in its pathogenesis. Okay. As far as listeriosis is concerned, you may get a gastroenteritis, a mild gastroenteritis. If you're a healthy adult, may even be asymptomatic. When pregnant women acquire Listeria, they become symptomatic. They can get sepsis, okay? It can cross the placenta when it goes septic. And there are two different presentations you need to be aware of as far as Listeria is concerned in infants. There's early onset disease versus late onset. Early onset is when Listeria crosses the placenta and it starts to infect the fetus in utero. The disease is called granulomatous infantisepticum, so remember granuloma, facultative intracellular. Very, very high mortality rate. You have sepsis, disseminated granulomas, and it's generally fatal, early onset disease. Late onset disease is in the range of neonatal meningitis. So again, it's going to be on the list of agents that can cause neonatal meningitis. You usually see this shortly after birth. Again, here's where your gram reactions are really going to pay off, okay? You have a case of neonatal meningitis. They give you a gram reaction. Group B strep, gram-positive cocci. E. coli, which is the next most common cause, gram-negative rods. Listeria, gram-positive rods. So just by knowing the gram reaction, you can see how you can eliminate a lot of the different organisms. Okay. In immunocompromised patients, Listeria can cause sepsis, but it can also cause meningitis in renal transplant patients and adults with cancer who are on chemotherapy. Diagnosis usually in culturing the blood or the CSF, and you can do a wet mount of the CSF looking for the tumbling type of motility, or you can do a gram stain. Treatment is generally ampicillin with gentamicin. Pregnant women are usually advised to not eat any cold cold cuts or cold deli sandwiches. They're supposed to heat everything in the microwave, and that helps to prevent Listeria infections.